This tutorial explains the lateral fascial compartment of the forearm, including the muscles and nerves. Two muscles are situated in the lateral compartment of the forearm, which are brachioradialis and extensor carpi radialis longus. Some sources alternatively classify these two muscles as part of the superficial extensor muscles of the forearm. Let's get started by talking about brachioradialis. Brachioradialis is the most superficial muscle on the radial side of the forearm and forms the lateral border of the cubital fossa. Brachioradialis is mainly responsible for the lateral contour of the elbow and the forearm. You can easily palpate it because its belly and tendon lie superficially. The muscle originates from the humerus, more specifically from the proximal two-thirds of the lateral supracondylar ridge and the anterior surface of the lateral intermuscular septum. The muscle fibers end above the mid-forearm in a flat tendon that inserts into the lateral side of the distal end of the radius, just proximal to the radial styloid process. The main function of brachioradialis is flexion of the forearm at the elbow joint, particularly when the forearm is in mid-pronation. The muscle also works in synergy with biceps brachii and brachialis to flex the forearm at the elbow joint. Brachioradialis is innervated by the radial nerve, which stems from the posterior cord of the brachial plexus. Moving on to extensor carpi radialis longus. Extensor carpi radialis longus also lies superficially and is partially overlapped by brachioradialis. Let me hide brachioradialis and turn the model around to better see its origin and insertion. So this is a posterior view of the forearm. The muscle originates from the distal one-third of the lateral supracondylar ridge of the humerus. The muscle belly extends approximately to the middle of the forearm. The muscle belly is then replaced by a flat tendon that travels distally along the lateral surface of the radius and inserts into the dorsal surface of the base of the second metacarpal bone. Extensor carpi radialis longus acts on the wrist joint, causing extension and abduction, or radial deviation, of the hand. These two actions are vital for effective hand gripping. Innervation for extensor carpi radialis longus is also carried by the radial nerve. Now let's talk about the nerves that pass through the lateral compartment of the forearm. This nerve is the radial nerve. Let me rotate the model to see its course more clearly. The radial nerve pierces the lateral intermuscular septum in the lower part of the arm and passes forward into the cubital fossa. It then passes downward in front of the lateral epicondyle of the humerus, lying between brachialis on the medial side and extensor carpi radialis longus on the lateral side. At the level of the lateral epicondyle, it divides into two branches: the deep or posterior interosseous branch and the superficial branch. Now let's look at the branches that emerge from the radial nerve. The radial nerve gives off muscular branches to extensor carpi radialis longus and brachioradialis, in addition to a small branch to the lateral part of brachialis. It also gives articular branches to the elbow joint. The deep branch of the radial nerve winds around the neck of the radius within supinator and then enters the posterior compartment of the forearm. The last branch that arises from the radial nerve is the superficial branch. The superficial branch of the radial nerve is the direct continuation of the nerve after its main stem has given off its deep branch in front of the lateral epicondyle of the humerus. It runs down, covered by brachioradialis on the lateral side of the radial artery. In the distal part of the forearm, it leaves the artery and passes backward under the tendon of brachioradialis. I will hide the muscle to follow the course more easily. Let me also rotate the model around to see the posterior surface of the wrist. After reaching the posterior surface of the wrist, the nerve divides into terminal branches that supply the skin on the lateral 2/3 of the posterior surface of the hand, and the posterior surface over the proximal phalanges of the lateral 3½ fingers. The area of skin supplied by the nerve on the dorsum of the hand is variable.